The Ministry of Health announced that the first heart transplant in Kuwait was successful.
The ministry added that this is a new medical achievement in collaboration with the Kuwaiti Saudi medical team. More details with Mariam Al-Dwayhi.
Today we had the pleasure to meet one of the men behind the miracle heart transplant surgery, Dr. Riyad Al-Tarazi, to tell us more about the latest achievement in the surgical field.
The lady was a 60-year-old lady who was reaching an end-stage heart failure despite maximal medical therapy. They've tried the maximal doses of medicines, maximal dose of diuretics. She was becoming worse and worse over the last few years, getting more short of breath, getting more water in the lungs because you increase the dose of Lasix and still it wasn't helping. So we reached to a stage where she needed something more than the medical therapy. And as I said before, transplantation is the gold standard. The people that make a big point in this operation is first the people who manage heart failure itself, the people who are involved. And I have Dr. Khaldoun Lahmoud, who is in charge of the heart failure program here, where we get end-stage heart failure. He's excellent in managing all these patients to get them over, into any trouble they have to, until they reach the stage where maximal medical therapy is not helpful. And this is when we start seeing that the patient is coming in more and more in the hospital, then we know that we have to intervene fast because their mortality increases the more you wait for them to get some kind of a device. And the other critical people that play a role here are the intensive care unit people, headed by Dr. Muhammad Shamsa, whom we worked together for the last 22 years, and Dr. Nawar Jabour, he's managing our intensive care unit, all the team of the intensivist with him, the operating room nurses, the operating room scrub nurses, the head of cardiology, Dr. Samah Al-Kharji. Everybody plays an integral part in this department. The labs, the technicians, this is very important, this one team. But the Kuwaiti Organ Donation Society and the Organ Donation Center and the Organ Transplant Center, Dr. Mustafa Al-Musawi, has been a great integral part in checking who are the donors, who are potential donors, recipients. They were here with us all the time to support us, to check which is the blood types and everything. Every time there's a donor, we know about it through a complete workup sheets. This patient, obviously, we had people fly from Abu Dhabi to harvest the liver, and the people from Kuwait harvested the kidney. So the Organ Donation Society and the Organ Donation Center and the Organ Transplant Center, Hamad Al-Isa has been an integral part in success of this program. We are heading more and more to having transplant in Kuwait for the heart transplantation because it's much easier for the patient family. They're with him, you have to fly abroad, spend 1 or 2 years waiting for a donor, then you have to spend an extra year after the transplant. That's what the people ask. After you're transplanted, you have to spend a year because there's a lot of talking about immune suppression of the patient, managing of infection, teaching him how to do many things. So imagine somebody sitting 3 years abroad with his mother here, father here, relatives. It's really difficult. And I think Abu Abdul Wahab, the minister, has been a great support. Actually, he's awake till 1 o'clock in the morning just waiting for us to say. And the Undersecretary, Dr. Mustafa Rida, is always on top looking at things, discussing. So I think, and the minister said, anything you need. I said, we don't need anything. All the equipment is available. And, he's ready to support the center. He's been ready to support any cardiac center in Kuwait.
The Ministry of Health is making history in organ transplant in the region. This is Mariam Al-Dwayhi for Kuwait Channel 2 News.